Hi, this is Dr. Steve Heilman. I wanted to go over a pre and post MRI of the lumbar spine following the findings of a lumbar spine disc herniation at L4, L5. If you look at this model here, or at this image here, this is the pre. This was done back in 2010, about 2 years ago, and 2.5 years ago. And you can see here when we point at this L4, L5 disc, you can see that the posterior aspect here has this large herniation where the disc material is protruding and pressing into the nerve matter, which is this white line right in here. On the radiology report, it is listed as a desiccated disc, which means the disc has lost its hydration. That's why the disc is darker than the disc below it. And that there is a 7 millimeter broad-based disc protrusion. And this was creating nerve tension signs down her leg, where it was making it difficult for her to use her foot. We were lucky enough that now currently we have a new film 2.5 years later, and it's going to show that this disc herniation is significantly better. On the prior, we can see that all of the findings up at the top are the same slice, same distance, and at the bottom we have it at the same facility. And this is exactly what you want to see when you have a pre and post MRI, is that you have the same radiologist and same slice to compare the before and after. You can see that all of the sequences and slices are the same on the new one. And here's the old one. And so when we look at the new one, here again is we're looking at our L4 disc. And you can see that the disc material has retracted quite nicely back in here, and that the disc is almost entirely contained to go through and not be pressing into the nerve matter anymore. Here is the recent one as compared to the old one. You can see how much annular tearing is in there with the disc herniation pressing into that nerve matter. Now this was not a spontaneous healing on here. This patient went through a rather intensive course of spinal decompression with some therapeutic exercises at our office. And she was quite successful, able to move her foot quite normally after the therapy, and has been able to go to her pre-injury activity level, even though she is 2 years older, but that's only chronologically. I'm sure she's feeling quite a bit younger now. If you have any questions, you can reach our office at 760-480-4480, and we can go through and see if our therapy can help you also prevent your back surgery. I'm out. It's Dr. Steve Heilman.